tonight.
Yeah, OK, that is femoral.
A man stabbed in a street brawl.
I know, this is painful, this is life-saving, OK.
An explosion leaves 2 men with severe burns.
They were working on a forklift and there's been a big bang. Yeah. A fireball has come out underneath.
A young girl is seriously injured in a hit-and-run accident.
What's the worst pain, chick, the one in your leg?
Yeah.
And a police chase ends with a suspect jumping off a road bridge.
They found loads of Class A's in his car.
They're trying to dig the devil out.
Ambulance service, is the patient breathing?
Yes.
Is the patient conscious and awake?
Yes.
What's the problem? Tell me exactly what's happened.
There's been an electrical fire on a forklift, and they've both got burns to their faces, 2 personnel. We're keeping them doused with wet cloth.
Which patient is worse?
Jay.
And can I speak to him?
Are you well enough to speak, Jay? Yes. Hello?
Hello, Jay. This is the ambulance service. Have you lost any blood from anywhere?
No.
No. And you burnt your face?
Yeah.
Did you just crash into this vehicle or...
No, we started the fault took up and it blew up.
It blew up? It was an explosion?
Yeah.
Okay, and is it around your nose and your mouth?
Yeah, full face.
Okay, an emergency ambulance is being arranged.
(7062) en route, an ETA of 10:10 minutes.
An explosion carries a high risk of serious injury from either the heat or impact of the blast. Critical care paramedic Karen Baker and Dr. Katie White immediately head to the scene.
So we've been tasked to a factory. It's a recycling factory, and what we know is that there are 2 male patients with facial burns. The things that we worry about with burns is they can be very painful, but also with burns to the face, you get swelling around the lips and the tongue, and that can obstruct your airway, and that can stop somebody from being able to breathe effectively if you lose that clear passageway. So it might mean that we need to intervene at an earlier point by giving them an anaesthetic and putting a breathing tube in.
A local ambulance crew are first to arrive.
It appears to be a forklift that has exploded to some degree with a rather large sort of fireball that's engulfed both casualties in flames. Both have burns to their faces and their hands. There are people standing outside ready to flag the crew down.
Hello.
Oh yeah, straight up there. You just follow the fire engine. He's going straight to where the other ambulance is.
Thank you very much. That's very helpful. Thanks.
The location is an industrial facility specialising in the disposal of hazardous waste. The casualties are being looked after by paramedics in the staff canteen. They're 52-year-old Paul and 26-year-old Jay.
Jay.
Okay.
Paul and Jay were both working on a forklift in a different unit. As they've turned it on, there's been a big bang.
Yeah.
A fireball has come out underneath.
Okay.
And it's taken both Jay and Paul.
Okay.
Paul started running, and he said the flames were actually in front of him as he was trying to run away from it. Knocked Jay to the floor, where he's got burns to both knees and both hands as a result of going down.
The pair managed to get themselves out of the building, and their colleagues have since been dousing their faces with wet cloths.
I've had a look in both of their mouths. I can't see any airway compromise at the moment. Just seems to be the swelling around the face and the loss of skin on the nose for both of them.
Okay.
All right.
Thank you. My name's Katie. I'm one of the doctors. Okay. Just put your tongue out for me. Does the inside of your mouth feel okay?
No, just my lips.
It's your lips. Yeah. It's on the outside. Okay, fine. But there's no funny sensation further down. You don't feel like your airway swelling or anything like that. No.
You can have a look if you want.
That's fine. No, fine. Okay. All right. How about the pain at the moment?
Pretty bad.
Okay.
Just face looks like it's on fire.
Yeah, fine. Okay, what we're going to do is we're going to get a needle in your arm, okay? We will get you some pain relief now, okay?
All right. Just open your mouth for me, as wide as you can. Stick your tongue out. Okay.
All right, lovely. Okay, you're all right. All right. So, pain being the worst thing at the moment.
Yeah.
Should we get some IV access on both?
Yeah.
And then we'll plan, should we try and get out to the trucks fairly swiftly? Would that be all right?
Both patients have partial thickness burns. These are intensely painful and will later swell up and significantly blister.
Let's get some morphine drawn up for them both.
A strong painkiller such as morphine is needed.
My ear feels sore as well.
Your ear? Yeah. This one?
Yeah.
Yeah. And open and close that fist for me. There we go.
Katie is cannulating Paul so that the drugs can be given intravenously and will take effect more quickly.
Little sharp scratch, okay? Coming now, well done. All right. There we go. Thank you.
Morphine.
Yep.
Calm down. Oh.
Lovely. All right. Oh, that's fine. You can rest it down now, okay? There we go. All right, I'm going to give you some nice pain relief now, okay? There we go. Okay? Well done.
Jay, meanwhile, will be given his analgesia in the ambulance.
I'll come out with this morphine as well and we'll get that into him.
Now, do you think you're going to be able to walk to the truck?
Yeah.
Right, just go steadily, okay? Because
Yeah, it'll be all right.
I have given you some painkiller, all right? We'll get you out. There you go.
Large doses of morphine can leave some people unsteady on their feet.
That's it. Watch the step.
All right.
Are you related? Are you?
Yeah, it's my wife.
Okay, all right. What's going to happen is we're going to take him to hospital, okay? I suspect it's going to be the Queen Elizabeth Hospital in Birmingham, okay? Just because they specialise a bit more in burns and it being on his face, all right?
On this occasion, the patients will be sharing an ambulance.
Kaz, I think, is he the worst?
Joe, I think he should go on the bed and the other fellow should go on the chair.
Yeah.
I think he's...
Yeah.
As Jay's facial burns seem more serious, he's given the bed, while Paul will be seated.
Paul, why don't you sit in that front seat in a second?
Yeah, okay, whatever you like.
And then one of us can sit there and one of us can sit there. We'll take really good care of him, okay? He's got a phone on him, so he'll be able to contact you, all right?
The team is preparing to leave for hospital.
That's the fire. And that is what's in those vats.
When some new and potentially worrying information comes to light.
But this was right next to the forklift. Chemical.
Okay.
Vats of chemicals positioned next to the forklift may also have been disturbed in the explosion.
In terms of the drugs, you see, we've been through this briefly before, haven't we? Yeah. But it's been a while.
It's the start of his shift, and critical care paramedic Jack Lewis is checking the contents of his emergency response car.
Keeping the cat and the morphine in there for the moment. Okay. Every day we will do a certain amount of checking, whether that is drugs or kit, just to make sure things haven't been missed.
It's a day like any other, except that this time Jack's wingman is a trainee, Sam Collison.
Jack, if there's anything I'm going to be good at today, it's going to be checking dates.
Already a paramedic, Sam's just started 18 months of advanced training, with the hope of joining the critical care team full-time.
So today I've got Sam out with me. He's just started his master's level study that we all have to do to work on these platforms. So we're trying to facilitate a little bit of exposure and experience for him in kind of how we work and what we do. Ready for the day, ready?
Ambulance service, how can I help, police?
Hiya, we've got a report of a coming through.
Okay, is the patient conscious and awake?
The person is currently bleeding, he's lying on the floor.
Okay, but they are breathing?
Yeah, he looks as though the fight's broken head.
Are the attackers still there on scene?
Yeah, we've got the offenders, believe the machete is still present at the scene.
The emergency services have been receiving calls about a fight in the street in Wolverhampton, involving several individuals.
What I'm gathering so far is we've got at least one patient with head injury and query, a second patient.
With two potential victims, Jack and Sam are dispatched.
Roger, that's all copied. We'll make safe distance and advise shortly. This is a response to multiple reports and what sounds like slightly confused reports from bystanders and police. We've got at least one patient who's been stabbed. There's a patient with head injuries from an assault, and then there might be one or two further patients who may also have been. So we're running towards this with an ETA of about 4 or 5 minutes. There's a paramedic officer running, one ambulance, and then Helimed 03 from Cosford.
An ambulance paramedic is the first on scene.
I've got a male with an arterial bleed to his left leg and a male with a head injury.
So we've got one patient with, he was described it as an arterial bleeding wound to the leg. That's significant. There's a very large artery that runs down your leg from your groin, the femoral artery, and you can lose a lot of blood very quickly from it. It's also quite a deep wound. So, you know, this has the potential to be quite a sick person who needs hemorrhage control. And depending on where that wound is on the leg, we may or may not be able to get good control. 7062 on the scene, thanks.
The violence has taken place on a quiet street in the middle of a housing estate. Jack and Sam head towards where a crowd has gathered around a man lying on the ground.
Oh, John.
An operational manager is coordinating the scene.
An arterial bleed to his leg.
Yep.
I've got 2 other patients, but I'll deal with them when the other crew's come.
Yep.
You can concentrate.
Yeah, no problem.
And then we'll swap over later.
Yeah, sure.
The patient has been stabbed, and a wound in his thigh is bleeding heavily.
Release pressure sec. Let's just see where we are. Come off, come off, come off. Yeah, okay, that is femoral. We need to get proper control.
Just as feared, the knife wound has severed the man's femoral artery.
Raphael, I'm going to cut these jeans, I'm afraid, mate. Okay, we'll get it.
Blood is spurting from the wound. If Jack and Sam don't get the hemorrhaging under control quickly, the man could die.
This is going to be tight and painful, okay, but it's going to save your life.
That's IV paracetamol going in, lovely.
In Wolverhampton, Dr. Katie and Karen are treating 2 men who were injured when a forklift truck set off an explosion at an industrial site.
How is the pain? Is it getting any easier?
No, not really.
No, still really painful. Okay.
Although the burns won't visibly blister for some time, 26-year-old Jay is seriously injured on his face, hands and knees.
Right. I'm going to give you a bit more morphine now. There we go. So, Kath, that's the other 5 of morphine.
Okay.
1735. Okay, you will be all right, all right? Okay.
Jay's colleague Paul also has burns to his face.
How's your pain?
Sore.
Sore.
Feels on fire.
Yeah.
He too is given more morphine to combat the pain.
Those barrels are quite
Yes, I've got the
toxic.
picture of it.
The company specialises in the disposal of hazardous waste. It now seems that barrels which were near the forklift contain a volatile chemical.
Fire have just looked in their top space and apparently they react quite violently with water and anything actually. They're just really quite toxic. If he's got inhalation or burns, we just don't know, so.
If any of the substance was caught up in the blast, Paul and Jay could have inhaled toxic fumes.
Okay, should we start moving? Yeah.
Katie and Karen want to get them to hospital as quickly as possible.
Don't need to phone anybody for you.
Leave me, Mum. Just let her know I'm all right.
See, Dad? Hold the walls.
So are you 2 friends?
Well,
Yeah, we're friends.
yeah.
Work friends.
We almost went to the Science Gate Treaty together today, Paul.
Yeah, I'll be all.
You'd have had to vouch for me when we got there.
Oh.
Paul and Jay will be taken to a specialist burns unit at Queen Elizabeth Hospital in Birmingham.
62. Thank you. We're heading to the QE. We've got both patients on board. One male of 26 years old who has got some partial thickness burns to the entire of his face, and also a 50-year-old male with similar.
What's your approximate ETA?
20 minutes over.
Put the blues and the teams on the floor, so.
So which one of you was in the forklift?
None of us.
The 20-minute drive is an opportunity for Dr. Katie and Karen to understand more about the incident.
I've gone off to have a look because he was making a strange noise. So I got off, I lifted the engine up to have a look inside.
And I was like next to him.
I said, well, we'll start it up just to see what happens.
When?
Did stand a chance, didn't Paul?
No.
When the forklift went up, did it Did it take those barrels with them as well then? Or?
I don't know. All I saw was flames just round the forklift, just like expanding from the forklift like a ball of flames.
Right.
And then when I turned around to run, the flames were in front of me at that stage, and I just ran. The bottoms of my trousers are all melted.
You haven't got burnt to your legs, have you?
I've got these. My knees are burnt.
The knees. Your knees are burnt?
Yeah.
You got...
That one's the worst.
Burns are very painful, aren't they? The reason we're taking you to the QE though is because that's where they specialise in burns and you'll get the best care you can get.
Yeah.
Right, because it's on your faces, just to make sure that you get really good care, all right?
Sounds good to me.
The men don't know what caused the fireball, but fortunately neither Paul nor Jay are experiencing difficulty breathing.
How's that pain?
Sore still. Yeah. Tight and sore.
Okay.
Yeah.
What about you?
Yeah, I can still feel the pain. Not as intense, but still feels like my eyes are swelling up as well. We keep getting crusty eyelashes behind. Yeah. I don't think I've got any eyelashes left. Not much, is there?
You've got some. You've got some. Yeah. There we go. Just pulling into the QE now, okay? Depending on where we go in, there might be quite a few people that come, all right, to have a look at you, and that's completely normal. It's just because we've alerted them that we're coming in with you, all right?
Paul and Jay have arrived safely in Birmingham, where a specialist burns team will take over their care.
Although those gentlemen were dealing with it very well, they were having a lot of chat and banter together and keeping each other's spirits up. Actually, they are both quite significantly injured. They've both got partial thickness burns to their faces. So I suspect the next steps are going to be that those burns are going to need to be cleaned and dressed. So sometimes that can be done just for some pain relief, sometimes it needs sedation, and occasionally they need to go to theatre. And following that, they'll probably need significant ongoing care here at the Specialist Burns Hospital.
There are more than 30 critical care paramedics working across the enhanced care network in the West Midlands. On shift today are Mike Andrews and Ryan Ferris, one of the newest members of the team.
Midazolam 4, please. Check. Ephedrine 1. Check.
Checkity check.
Ding, dang, do.
Blankety blank. You don't remember blankety blank, do you?
Of course I remember blankety blank.
Don't, man.
No, I've got a clue what you're talking about.
If you were as old as the hills like me, you'd know that. You'd know all about blankety blank.
You're just like a cool older brother.
So that's drugs done, PPE's on. I think we're good to go.
Ambulance services, the patient breathing.
No, he's not.
He's not breathing.
No, he's not. And he's bleeding out.
I need you to listen to me. Is he breathing?
Yes, I am breathing. Why do I need to sit down?
Are you the patient?
Yeah, but it hurts.
Okay, stay on the line with me. An emergency ambulance response has been arranged.
Male in his 20s, to stomach. So ETA's about 5 minutes.
A wound to the stomach is a potentially life-threatening injury. An ambulance is already en route, and as their advanced skills may be needed, Mike and Ryan are dispatched.
So we're responding to a male in his 20s. The reports are that he's got a wound to his abdomen. The risk is that the patient's hemorrhaging internally, whether there's a large vessel involved or he's bleeding from an organ, and it's non-compressible, so we can't actually stop that hemorrhage by doing simple things like direct pressure.
Catastrophic wounds can require immediate life-saving surgery. Mike and Ryan must be ready to act quickly.
I think that we just get on minimal IV TXA.
Oh, God,
shoots off.
Do that on route, yeah.
62, go ahead.
62, give the deed down on the fully off the shop, free on take 2568.
62, that's received, in mobile.
Allocating the right resources in the right time frame is a difficult juggling act for control. An ambulance crew has reached the victim and found his wounds to be less serious than first feared. Meanwhile, another high-priority job has come through.
55-year-old male who fell onto the train track.
Mike and Ryan are diverted.
We've got reports of a 55-year-old male that's fallen onto the train tracks at a train station and is wedged or trapped between the train and the tracks themselves. It sounds like the patient is conscious at the moment, but we're not sure about any of the details yet.
We always take speed of the train to get the platform when this gentleman actually fell. No further resource required from Ambo. You have all of the resources down.
Roger that, all copies. Thank you.
The ambulance crew on scene has decided critical care backup isn't needed. So after being stood down twice in 5 minutes, Mike and Ryan are now available for the next emergency call. And they don't have long to wait.
Ambulance services, patient breathing.
Yeah, she's breathing. So she's broken the bottom part of her leg above her ankle, but it is quite bad.
Okay, how old is the patient?
15. Okay, so I think it's fully split because it's at an angle quite bad. So I've told her not to look at it.
Okay. Do you know how she's done this, love?
Someone just drove into her on an electric bike.
And have you gone into her quite fast?
Yeah, I think it is quite fast that he hit her.
Okay, we will get there as soon as we can.
A teenager has been hit by an electric vehicle, sustaining potentially life-changing injuries. Luckily, Mike and Ryan are close by.
It's a child that's the patient. Unknown injuries at the moment, apart from a suggestion that there are leg injuries involved. So I'm assuming they put a backup request because they're either injuries that are potentially limb-threatening or difficult to manage. We should be on scene in about 5 minutes.
6-2, I've just spoken to the crew. This is a child with what sounds like significantly displaced tib-fib.
Roger, mate, that's all received, thank you.
A tib-fib fracture means both of the bones in the girl's lower leg are broken. It's a serious injury requiring urgent surgery.
So it sounds like a closed fracture, so the bone's not penetrating the skin of a lower leg, but it's grossly deformed by the sound of it.
Okay, mate, you're all right.
You all right? Okay.
At a housing estate in Wolverhampton, Jack and Sam are treating a man who's been during a fight in the street. The femoral artery in his thigh is severed and is spurting blood. Jack and Sam urgently need to get the bleeding under control by applying a powerful tourniquet.
Get high. Nice and high. Right under there. I know this is painful, this is life-saving, okay? We'll get you some pain relief, okay? Yeah.
Happy with that at the moment.
Tights. And then pressure dressing.
The pressure dressing should also help to prevent excessive blood loss.
So we've got a wound here, let's get this top off, let's have a good look everywhere.
It's all right, we'll get
The man has a less serious cut to his hand. Jack wants to be sure there are no further wounds.
Right, your box is coming off as well, mate, I'm afraid. But I need to check your groin, okay? I'm sorry. We'll get you covered as soon as we can. Sammy, you right there? You got control?
Thankfully, the man has no other injuries.
We're covered, you're covered.
Just pop this leg flat for me, mate. That's it, and we'll get the blanket over you. I want to keep this leg out so we can keep this eye on this leg.
He's not. He's talking to me, but I promise we're here. I'll look after him, okay?
He's on.
With his bleeding now under control, the patient must be cannulated so drugs and fluids can be given intravenously.
I'm not seeing any obvious access.
Right, I'll have a look if you can get the rest of that top off and get the mantra on that side. Let's get blood pressure. Pads, please.
We'll get his legs up as well.
Jack manages to find a suitable vein and administers the first dose of painkillers.
TXA?
Six days ready to go, mate.
Next is tranexamic acid, which helps the blood to clot.
Happy we've still got control? Bleeding through. Got a blood pressure? Can you turn them on so I can see it? Blood pressure and heart rate. So we've got weak radial pulses on this side, very weak.
The man has lost a lot of blood and remains critically ill.
And can we get, have we got a stretcher? Yeah, stretcher and scoop. Let's get the stretcher right next to him and let's get him on it.
It's vital to get him to hospital as quickly as possible.
Right, sir. With our help, on your good leg, I just want you to stand and we're going to twist and pop you on the stretcher, OK? We're going to help you do it. You can help. One little quick push on that good leg. We're going to get you up and on the stretcher, OK? Right, good leg, bend it.
I'll cover you up, mate, yeah, I'll cover you up. Don't worry. Can we raise his feet up as well before you tighten that up?
Legs up.
Yeah, raise his feet up first.
Raising the patient's legs helps maintain vital blood flow to the heart.
That's it. Bring your good leg over for us, mate. That's it. Okay.
Is there a strap? We'll come back to you in a second. Queen Elizabeth, Birmingham.
The air ambulance crew has now also arrived on scene.
Hi, Jack.
So Jack can hand over the wounded man to a doctor.
So this gentleman has got a single significant femoral wound. It is arterial, bright red, spurting, good control by belt and pressure prior to our arrival. Best blood pressure, 84 systolic. Bleeding now controlled with cap tourniquet and the dressing, as you see, with some Cheeto over the top. IV access. He's had his TXA, and we're good to go. I'll jump off and look at the next lot if you're happy with that handover. Yeah. And we'll go from there. All right. Thanks, guys. See you later.
Jack and Sam are now able to treat a second patient.
Was behind you, the chap with a laceration to his head.
Yeah.
The crew's there. They're going to stay outside the cordon. So he's able to walk. He's just got a right shoulder injury and a head injury.
Fine.
So if we walk in this way,
yeah, walk into the
pop
crew.
him on there and you can assess him.
Anyone else you want to look at?
No, there's nobody else.
Okay.
The second man is less seriously wounded.
Have a sit there for us, we'll sort you out. Have a sit down. How are you feeling?
The patient has a cut to his head and a dislocated shoulder, but does not require any specialist pre-hospital treatment.
The first patient that we saw today has got a significant arterial wound and is going off to the New Queen Elizabeth Hospital with the air crew, so we handed over to them and they're travelling with him to QE, the Major Trauma Centre. Our gentleman there, he's got a couple of wounds, he looks a bit pale and a bit sweaty, but there's no obvious cause for that, so I think that's probably a stress reaction. So he's going to Sandwell, and we're clear.
Ambulance service, is the patient breathing?
Yeah, it is, yeah.
Yeah, is he awake?
From the police. We've had a high-speed pursuit down the motorway. The chap's crashed, but then jumped over a barrier, falling maybe 3 or 4 metres. When we got to him, he was lay on the floor, shaking.
No problem, we believe he was fitting.
Potentially fitting. He's quite clearly taking some drugs. Keeps going into a state of unresponsiveness.
A police pursuit in northeast Birmingham has ended with a road traffic collision. The driver who crashed requires urgent medical attention.
Yep, cheers. We'll be there in about 6 minutes, 5-6 minutes. Proceed, thank you.
Critical care paramedics Stephen Mitchell and Dr. Richard Fawcett are dispatched.
What we've been told is there's been, I presume, a police high-speed chase down the motorway. Something's happened. One of the occupants has got out, run across the motorway, and has appears to have started fitting at the roadside, but it's not quite clear what's caused the fit or if anyone else has been hurt. Sounds like this guy jumped over a barrier, so he might have sustained a head injury.
The accident's taken place at a busy motorway junction.
Currently got handcuffs behind his back and he's sat up on the floor. We're a little bit concerned because it's come from probably 10, 15 sort of in the air, landed. We'll be able to try and get further if they want to get to the team in the line. Roger, all received, thanks.
As well as crashing his car, the man appears to have fallen from height, adding to the risk of injury.
Myself, 991
I we're about 1 minute, 1 minute's way.
I think that's the job down there by the looks of
Oh,
things.
okay. So potentially jump over this right-hand blood thing, that's what they were talking about.
The patient has landed on a slip road underneath a flyover.
That's my answer.
Richard is updated by an operational manager.
Hey, yeah.
So basically, it crashed at approximately 120 miles per hour up here following a police pursuit.
Oh, wow.
Then jumped over here. Police are a little bit reluctant to release the handcuffs just because they've had dealings with him before. He's a real big handful. He is so sweaty.
He's probably taken something, hasn't
Well, we think they found loads of Class A's in his car, so we think we're not sure if it's the fact that he has come down and hit something, or whether he's under the
probably a
influence.
combination of both, to be honest.
At the speed he crashed, the driver can expect to be seriously injured.
You're right there,
But so far, his behaviour is preventing anyone from examining him. He's shaking uncontrollably and is in some sort of trance.
So has he been like this since you guys got to him?
He's been groaning, he's been trying to eat the dirt.
Police and paramedics have restrained him for his and their safety and are trying to move him using a carry chair.
Wheel him back. Do you want to take one side of the legs and I'll take the other?
We can
Mitch coordinates the efforts to get the man into an ambulance.
You jump over this side.
I almost died.
And then swing your... That's it, you got it. And then, yeah, just lift him over, yeah.
1, 2, 3.
Oh, I thought you got it.
What's your name, mate?
Yeah, you want to roll him over?
Just want to make sure there's
Yeah, go on. Pockets. Yeah, go for it.
Now on the ambulance, Richard and Mitch can properly assess the patient in the light.
It's all right. No.
If they can get him to cooperate.
Cannabis and cocaine.
Oh, there's a crew up there. Shall we,
Oh, here we go.
In Northfield, critical care paramedics Mike Andrews and Ryan Ferris are arriving at the scene of an accident.
What's the worst pain, chick? The one in your leg?
15-year-old Sophie Lee was walking home from school when a motorised scooter, travelling at around 40 miles per hour, crashed into her.
Push against my hand with this foot. Push hard.
The driver rode off, leaving Sophie Lee lying on the pavement.
Any pains around your hips at all? No, nothing there.
Sophie Lee's mum arrived shortly after the accident.
Her best mate rang and was screaming and crying and said that a lad on a bike, e-scooter, hit her, threw her up in the air and just shot her and just left her. When I came, all her ankles were bent.
So you don't remember anything about what happened?
I just remember falling, that's it.
Okay, and since then, do you remember the ambulance guys getting here?
Yeah.
Yeah.
Sophie Lee hit her head in the fall, and her memory loss is a sign that she may be concussed, a state where the brain is unable to function normally following a traumatic blow.
So, at the minimum, the fact that she's talking to us, that's fantastic, okay? From the initial cruise assessment, it looks like it's just this lower leg injury, okay?
The ambulance crew have managed to realign the broken bones in her leg, which will help the blood to circulate and prevent further damage.
So, we'll take her daughter up to Birmingham Children's, they'll x-ray it, we'll let the orthopaedic team review it and see what their management's going to be from there forward, okay? Now, I appreciate she's almost looks like she's ready just to go, but it's very bumpy in the back of these. It's pretty miserable, to be honest. So I think the guys, we're just going to give a bit of pain relief on board for her first before we move, get her a bit more comfortable. Okay. I mean, they're just going to give her they're going to put a cannula in her arm, and then I think they'll probably give her a bit of paracetamol for that to start with, and then we'll maybe even give her some morphine if she needs it, if the pain's quite bad.
Even with her leg splintered, Sophie Lee's injury is still causing her considerable pain.
So Rob's going to stick your needles in you, so we can give you some good pain relief, all right? So,
15, so,
yeah. Oh, yeah.
It will, don't worry.
Yeah, thank you.
Please don't put it in my arm.
You won't feel it, honestly.
Once it's in, you'll be sorted.
Sophie Lee desperately needs pain relief, but a phobia of being cannulated is causing her to panic.
No, please don't put it in my arm.
Oh, sorry, that's like you're on the edge.
Please don't put it in my arm.
Okay, that's fine. I'll try your other hand then.
Look at me, look at me.
Well done, sweetheart, that's in.
Squeeze it in.
Yeah. Sweetheart, you're just going to feel some stickers on that just to keep it there, and then Mike's going to put some water through while I get some pain relief ready.
Okay, you're doing ever so well. Well done. That was the painful bit done and dusted, really. How are you feeling now? Still got that pain in your lower back?
No.
No, has that gone a bit, has it?
When am I getting pain relief?
30 seconds time. We're just literally takes 30 seconds to attach you all up. All right, sweetheart. There we go. It's starting to run now.
So is that pain relief?
Yeah.
Yeah. Thank you.
That's all right. Don't need to thank us.
How long would it take to kick in?
30 seconds. It starts straight into the vein, that is. That's a 5-star service.
Are you going to get me to the hospital quick?
Yeah.
Yeah, we're getting a blanket, yeah. You're all right, babe.
Let's warm you up a bit, yeah.
It's all the shock kicking in, isn't it, sweetie?
Right, I'll leave you to it then, guys.
Cheers, Mike.
Thank you very much. Nice one. Watch how you go. They look after you now. Okay.
As the ambulance crew prepare Sophie Lee for the journey to hospital, Mike radios into control.
She's a 15-year-old female. She's a pedestrian that's been struck by what we believe to be an E-type scooter or moped-type vehicle. The patient has a closed lower leg fracture, tib-fib, which has now been aligned and has been splintered.
You're all clear, aren't you?
Yeah, we're good, mate. The crew's happy that we stay behind, so we're available if needed.
Sophie Lee will be taken to Birmingham Children's Hospital, where the specialist orthopaedic team will decide on the appropriate treatment. In northeast Birmingham, Mitch and Dr. Richard are treating a patient who's been involved in a high-speed police chase.
Did he crash the car?
I believe so, yeah.
And he's dropped as well.
The man crashed his car at 120 miles per hour at a motorway junction before jumping over a barrier and falling onto a verge below.
Probably from whereabouts that van is. Yeah. So, I mean, it's a good 15, 20 foot.
Yeah,
He also appears to be in the grip of some kind of psychosis, possibly drug-induced.
Mitch, you're going to need to give him something. It's unmanageable. It's hard to tell whether he's actually got any injuries or anything. But it's the high-speed RTC as well. So he needs to go to the QE.
The patient could have serious hidden injuries.
He's eating the bar. Look at him.
But in the state he's in, it's impossible to tell.
Let's give him some benzos if we can get a line in. And then if he's taking lots, we'll titrate with some propofol.
I'll go and get the bag.
Yeah, let's just get the bag. Try and get...
The man needs to be taken to hospital for a thorough checkup. In the meantime, he'll be given medication to counteract any narcotics that he may have taken.
So what we're going to do is we're going to give him something to settle him down a bit, just so we can manage him safely and check him over properly. He doesn't appear to have any obvious injuries, but what I would say is that it's difficult to say. So we're just going to get him settled down and then we can have a really good check over of him. It appears that he's took some drugs and that's probably what the situation is, and that's what we're going to treat him as. So. That's midazolam.
Yeah.
5 milligram.
Have you got a bandage?
The patient is given midazolam, which acts as a sedative.
I mean, give it a couple of minutes.
Mitch updates the control desk.
He's been involved in a high-speed RTC. basically he's gone into a barrier at about 100 miles an hour. He's then alighted from the vehicle, jumped probably 20 foot max. It appears that he's taken some drugs and he appears to have acute behavioural disorder type symptoms. Currently handcuffed but secured to the stretcher in the recovery position. We've just given him some midazolam just to settle him down. If you can do the call to QE with an ETA of probably 25 minutes, Evan.
QE, what do you got?
Right, we're going to go. See you in a bit.
Birmingham's Queen Elizabeth Hospital is a 25-minute drive away. Over the course of the journey, Dr. Richard closely monitors the patient to make sure his vital signs remain stable. Once at the hospital, he's handed over to the specialist trauma team.
So this was quite a challenging case for us. We do know they had a lot of Class A drugs on him. He is known to the police for both violent behaviour and sort of drug use and transporting of drugs. He had a lot of kind of clinical features of someone who takes Class A drugs that are kind of eat the ground and chewing on the stretcher bars and stuff like that, as well as some of his physiological stuff. So, you know, his heart rate being 150 and being very sweaty. The fact that he was so agitated and needed physically restraining in order to administer any aid with it for him, this makes our job so much harder. So we've brought him all the way here to the major trauma centre where he can be scanned, and if he does have any injuries that are hidden behind all that agitation and kind of other factors that are going on, then he's in the right place to go for damage control surgery.
Come in.
All right, mate.
Hello, how you doing?
Going, son?
Good to see you.
All right.
Oh, you're looking well? Yeah, and you?
It was scary. The pain was horrific. The burns went through different stages. We went from a scabby phase, and then we just went, all of a sudden, our faces just swole up.
And you looked at your pillow and it was like, there was like...
Oh, grease and...
Yeah, stuff on your pillow and pus. I've pretty much made a full recovery now. Just stay out of the sun because your skin's like brand new baby skin.